to have a family medicine provider, especially that primary, one person who really knows you, somebody who you can build a relationship with and learn to trust. And then when you do have concerns or questions, they know your history already. You don't have to rehash every time you go to a new provider then what your history is, what your concerns are, who you are, and it really kind of helps the continuity of care, and it saves time, and it's just a trusting relationship that you can build. It helps that they know you too, because then you're not as likely to miss something. If you go to urgent cares all the time and see different providers, they have their place, but if it's continuous, maybe they'll miss that, your blood pressure has been rising each visit, and maybe that's a problem you didn't know and they wouldn't have caught it. Little things like that can be caught by your provider if they know you. I can help monitor my patients when they see specialists, because I usually get their notes from the specialist. They send them to us, and then I'm able to kind of review them and keep them, and I'm in a safe place. It's the medical home is what the primary care provider should be. So when I see those notes come back, I can review them, and then when my patient comes back for a follow-up visit, I have that I can look at, and then we can talk about any changes. We can incorporate that into our own care. As a primary care provider, we can do a lot of basic treatments, assessments, diagnoses. If you're a generally healthy person, sometimes the primary care provider is the only one you're going to need. If you require more specialized care, and is a little more complicated, of course, we're going to send to the specialist. We can refer to anybody that you choose. The great thing about PCI is that we have access to a lot of specialists right here. We can communicate directly with them, and we can get people in a fairly decent amount of time for the most part. We have a good working relationship with them. That being said, PCI is its own entity, so we're not affiliated specifically with one hospital or the other, so we can refer anywhere you want to go. You're not tied just to PCI, you're not tied to anywhere, so we can really work with you to get you where you need to go and make that referral, and then follow up with you when the referral is completed. Navigating the healthcare system can be very confusing and very overwhelming for patients. Even if you know something about the medical system, it can be very daunting. As a primary care provider, I can kind of help guide people through the system. First, they start with the primary care provider, and I can refer them in the right directions, but I also can keep tabs on where they're going. If they have questions, if they're not sure where to go, if they don't know why they're going to a certain place, they can call our office. They can talk to me. They can talk to my nurse. That's what we're here for, is we are their foundation. We are their groundwork. So then as they move through the system, if they need to go to a specialist, if they need to go get certain scans done, we can help guide them through that process. And if I don't know the answer to something, and if I don't know where to go, I'm going to find somebody who does, and I'm going to get the answer for them.